In this video, we'll look at the surface anatomy and ultrasound of the anterolateral leg, foot and ankle. Before we do this, we will quickly recap the muscles of the anterolateral leg using a plastic model. The following muscles can be seen on the model: tibialis anterior, extensor digitorum longus, and if we rotate the model, peroneus brevis and peroneus longus. On this view, we can see the tendon of extensor hallucis longus running to the big toe. The muscle belly sits very deep in the anterior leg, therefore it's not visible on this model. We can also see the four tendons of extensor digitorum longus running to each of the other toes. Now we'll move on to look at the surface anatomy of the anterolateral leg, foot and ankle on a real patient. The tendons of the following muscles can be seen in our patient: tibialis anterior, which dorsiflexes the foot; extensor hallucis longus, which extends the great toe; extensor digitorum longus, which extends the other four toes; and peroneus longus and brevis, which everts the foot. If we move to a medial view of the foot, we can demonstrate how to palpate the two major arteries of the foot. Firstly, we'll demonstrate how to palpate the posterior tibial artery. To do this, locate the medial malleolus and place your fingers about 2 centimeters posterior to this, about here. The other major artery of the foot is the dorsalis pedis artery. To palpate this, locate the extensor hallucis longus tendon and palpate just laterally to it. This is important clinically when you assess a patient with peripheral vascular disease. Finally, we're going to demonstrate ultrasound of the anterior leg and the ankle. If you place the transducer on the anterior leg, several structures come into view. The bright white line in the corner of the screen is the tibia. We know this as the tibia is a bone and ultrasound waves cannot travel through it. The rest of the image, there's a muscle. We can identify this muscle in two ways. Firstly, by the position of the probe on the leg, we know that it must be tibialis anterior. However, if we were in any doubt, we could ask the patient to dorsiflex his foot. As you can see, this has contracted the muscle, and we know that tibialis anterior dorsiflexes the foot. Now if we move the transducer to the medial ankle, we can demonstrate the posterior tibial artery. You can see it pulsing nicely in the middle of the image. We use ultrasound in this way in clinical practice if we're finding it difficult to palpate the posterior tibial artery. In this video, we used a model to demonstrate the muscles of the anterior leg. We saw the surface anatomy of the anterolateral leg, foot and ankle, and used ultrasound on the anterior leg and posterior tibial artery.